This presentation is over delta-9 tetrahydrocannabinol, which is a marijuana derivative, and the medical term for it is Dronabinol. It is basically THC, which is the marijuana derivative, and it's the primary psychoactive ingredient that is in marijuana. It binds with cannabinoid 1 receptors in the human brain, which affect the release of neurotransmitters related to pain, immune function, stress, sleep, and digestive function. It is a Schedule II controlled substance, so it is highly regulated and highly addictive, being that it's the psychoactive effect of the marijuana. It is only used for patients with higher reward versus risk of addiction, or patients who have bad reactions to conventional treatments. It's only available in an oral capsule or also an oil that is oral as well.
The effects, so really it is used as an appetite stimulator, an anti-anemic, basically vomiting or nausea, and then an additive for pain relief. So this is frequently used for cancer patients who are going through chemotherapy or radiation, because they have that appetite reduction as well as that nausea with the chemotherapy. As I said, yes, the chemotherapy. Also, AIDS patients use it frequently because they use it because they have that anorexia, which is frequently associated with that AIDS, and they have that appetite reduction, so this will help to stimulate their appetite. There's a study in Germany which talked about using it in multiple sclerosis as a way to reduce spasticity, and it was a mucosal spray with a 1-to-1 ratio of THC to CBD, and that found great effects.
There are a lot of side effects, adverse reactions, and warnings related to the THC compound. The ones that happen the most are that there are central nervous system effects, which is the euphoria, that is the psychoaffective side of it, which is for the antiemetic and appetite stimulant. Those are over 10% of patients have those side effects. There's also central nervous system and gastrointestinal side effects that are a little bit higher, which are abnormality in thinking, dizziness, drowsiness, paranoia, abdominal pain, nausea, or vomiting that are related to them, but those are about 3 to 10% of patients who are on this medication experience those. There are lots of other effects, but a very small percentage of patients experience them. There are some contraindications, which are hypersensitivity to the drug Dronabinol, sesame oil, alcohol, or any component of the formulation, receiving or having recently received disulfiram or metrodiazole containing products within 14 days. There are a lot of studies related to the marijuana just because of all the research that's coming out in order to legalize marijuana or debating on whether or not it should be. But there still is more research that is needed for this drug specifically. There's no clinical trials to date comparing effectiveness of medical marijuana to conventional antiemetic drugs for cancer patients. More studies are needed with the rise of legalization of medicinal and recreational marijuana to evaluate the safety and efficacy of Dronabinol in the clinical setting to stimulate appetite and actually reduce secondary anorexia. It is not recommended THC as an antiemetic for nausea and vomiting associated with chemo through certain cancer networks, but there is research regarding it's the best way to achieve a therapeutic index through the oral or whatever way it is taken. There is also research that it can be used to decrease pain for chronic non-cancer patients as an adjuvant analgesic, but they need more research to compare the efficacy of the Dronabinol to the opioids on their own as a pain medication. Oral Dronabinol also has similar psychoactive effects to smoking marijuana, and research has shown that this risk has to be included in any clinical decision for prescription for analgesics or antiemetic use. This means that it needs to be very specific on which patients are taking this with the risk or reward of becoming addicted to it at end of life.
Popular opinion. So this obviously is fairly controversial, and it really does vary by state. As you could probably guess, there's more support in states where marijuana is legalized, especially states like Colorado, whereas North Dakota, which is typically more conservative. We just had that bill that we voted on back in November where it did not pass and marijuana was not legalized. So there's typically going to be less support in conservative states like North Dakota and more support in states like Colorado. So opinion really does vary. Also by age, various other things like that. Medically, there's kind of a lot of medical professors are not sure, they're kind of still waiting for more research. However, THC, this drug that we're talking about, is regulated by the FDA, so it's fairly consistent, and there are a lot of trials that are currently in the works. THC can be addictive and it can make patients high, which can be very scary for patients who are, if the doctor prescribes this or if they're looking into this, that can be very scary. There's also a social stigma just because many people associate it with marijuana and potheads. Another thing is that THC can be confused with medical marijuana, which is only legal in few states and is much less regulated, and that's really just a prescription to grow a certain number of plants, that sort of thing if you have a certain diagnosis. Similar drugs, so THC is very, very often confused with CBD oil, cannabinol, which is a legal over-the-counter supplement. We can even find that here at the Loaf and Jug, here in Bismarck. CBD oil is a hemp-derived oil, very similar to marijuana from the same plant, but without the psychoactive component in THC. So you will not get high with CBD oil.
CBD oil stands for cannabidiol, which is an oil extracted from hemp plants, but it is THC free. Unlike most marijuana and THC, there are no psychoactive side effects, though this is not very regulated by the FDA, so some of the hemp may have some THC show up, so not every brand is good as well. Most of the side effects that occur with CBD oil are likely the result of drug interactions between CBD and other medications that patients are taking. It can be used for seizures or epilepsy, inflammation, pain, different mental disorders such as psychosis, depression, or anxiety, inflammatory bowel disease, nausea, and migraines. Like I said, because it's not regulated by the FDA, not every brand is good, and it can be, like Sofia said, it can pop up in a loaf and jug. It is legal over the counter in most states, and it may show up on a drug screen since it's not regulated by the FDA, and there are CBD specific drug tests as well. So the general recommendation that we have if we're talking to our family about this is that the Delta-9 THC, the Dronabinol, is the prescription that is only used for patients with terminal illness such as cancer, AIDS, or with high complications with conventional treatments. This is useful for increasing appetite and decreasing nausea for some patients with anorexia secondary to terminal illness or with nausea secondary to chemotherapy, but it does have some psychoactive side effects. The over-the-counter cannabinoid derivative that is legal is CBD oil, which is what some people will think of when you hear the Dronabinol, THC, anything like that. And it can be used for a wide range of conditions, but not all of them have been researched. And it does not have psychoactive side effects. You have to be careful though, because it's not legal in every state and it's not regulated by the FDA, so you need to be careful of the suppliers and the laws in the state that you're looking at.
Thank you very much. Here's our citation.